Hi, I'm Gabrielle. We're doing IV antibiotic administration. To start, I'm going to roll dice to find out which antibiotic I'm giving. And that is
9.
9. And so I will be giving cefuroximine. So I find it in my drug book. And I dilute each 750 milligrams with 8 milliliters of sterile water. So I'm going to do some math. So I have 500 over, now I'm going to check against this, 750 times 8. Is 5.3 milliliters. 5.3 plus 100 is 105.3. 105.3 divided by 0.5. Is 210.6, rounding to 211. 211 times 10 divided by 60 is 35 drops per minute. And now I'm ready to start my first check. I have 500 milligrams of cefuroximine, prophylactic antibiotic via IV every 8 hours at 0800 hours for Anna Perry. And it is the correct date. And that's all my checks, and here's the documentation. And now I'm ready to withdraw 8 milliliters of sterile water. I'm going to place this in the sterile field and sanitize the tops. And while that's drying, I'm going to do 8 ml of air and place the top in the sterile fields to maintain its sterility. I open this and screw this on without touching any of the parts that will touch the patient. Now I remove the safety feature and remove the cap. And now that it's dry, I inject 8 ml of air. Now I invert and draw back 8 ml of sterile water.
Go.
And now we're going to continue with our sterile water drawing. Now I'm going to bring it a little bit past 8 ml so I can tap the air bubbles out. Now I'm going to scoop. there are a couple air bubbles, and now it is perfectly at 8 mils. I'm going to inject it into the medication. Safety cap on, and I'm gonna agitate it to mix the medication with the reconstitution fluid so that the dose is accurate. Now I just make sure it's all diluted in there, and it is. And because it was just in my hands, I'm not sure if I touched the top or not, so I'm just going to sanitize it again just to be certain. And I can discard that. And I wait for it to dry. And I double check my math. 500 over 750 times 8 is 5.3. All right. Perfect. Now that it's all dry, I remove the cap. Inject that. Invert and carefully withdraw 5.3 mils. There we go. And as you can see, it's right between the 5.2 and 5.4 line. I put the safety cap on again, just to protect myself. And I'm gonna do my second check. I have cefuroximine, 500 milligrams in 5.3 milliliters as a prophylactic antibiotic via IV every 8 hours at 8 o'clock in the morning for Anna Perry on today's date. And here's the documentation. So that's my second check. And now I'm gonna do the medication sticker. All right. A. Perry, room number 4, drug (500 milligrams in 5.3 ml), added by Gabby Hawes, PNS, NIC, on today's date at 0800. Flow rate is 35 drops a minute. Start time is now and expires at that time. Now I'm going to do my third check to check the dose against the vial a second time. So I have cefuroximine, 500 milligrams, for Anna Perry at 8 o'clock in the morning, prophylactic antibiotic via IV every 8 hours. Here's the documentation on January 19th, 2021. And I have 5.3 mils. Yes. Now I'm ready to add it to, I'm gonna put the sticker on the dextrose D5W, and I have double checked that it is a safe diluent for it. Now I remove the safety feature, remove the cap. Just kidding, I forgot to sanitize the little part, but that's okay, as long as I hadn't done it yet. And now as it's drying, and now that it's dry, I inject it carefully, straight, not to puncture the bag. Safety feature in the sharps box. And I check it another time. I have cefuroximine 500 milligrams in 5.3 milliliters for Anna Perry at 0800 of prophylactic antibiotic via IV every 8 hours. And that's all of them. And now I have my pen, sanitizer, normal saline for flushing, and I dot the MAR. And normally in practice, I would put the MAR in a drawer for patient confidentiality. Good morning.
Good morning.
My name is Gabrielle and I'm your LPN for today. Do you mind telling me your name?
Anna Perry.
Perfect. I'm just going to check your wristband, and as I'm doing this, I'm checking the bed breaks. And do you mind telling me your birthday?
November 15th, 1962.
Perfect. Thank you. Do you mind if I raise your bed for a bit?
Yeah, no problem.
Thank you. All right. I am just here to change out your IV antibiotic. It's just a protocol. It's just normal for every patient who has surgery to receive an antibiotic to prevent an infection before it happens. It's perfectly safe, and it doesn't mean you have an infection. It's just preventing it before it gets bad.
Okay.
Now I'm going to inspect the site. I'm looking for any redness, edema, and any signs that that the IV is misplaced, but it appears to be in perfect condition. I'm also checking the IV here. It is not expired, and there are no bubbles in it, and there are no cakes or anything. Now that I know that all the IV stuff is in tip-top condition, I'm going to sterilize the Luer lock and then flush. I'm going to wait for it to dry, and it has dried now. I'm going to screw it on and do a flushing motion of quick 2 milliliter flushes, but because this is a doll, it's not going to work. But we'll just pretend that it did. And I can actually show you in a garbage bag what I would do. I'm going to remove this tubing, invert it so I don't get medication all over myself, remove it, discard, and then remove this blue tab. and being very careful not to touch any of this because it is sterile. And now that it's attached, I would normally attach it to him, but because it's a doll, it wouldn't run. So I'm just going to put it in the garbage so that I can actually calculate the flow rate. And it will be around 9 drops per 15 seconds. I have my watch here. I just very slowly ensure that all the tubing is open. So I very slowly move it open. And that's about 9 drops per 15 seconds. And Mrs. Perry, I wanted to talk to you about the antibiotic.
Okay.
You may experience some diarrhea. This is normal with antibiotics, but if you find that you're going constantly, let us know so that we can make sure you stay healthy.
Okay.
Do you have any questions?
No, not at all. Thank you.
Perfect. I hope you have a lovely day. Your call bell is right here. Let
Perfect.
us know if you need anything at all.
Okay. Thank you.
Thank you so much. Nurses station, I'm going to sign the MAR. I'm going to go GH, PNS, NIC, and the date.
Good job.